Thank you, Mr. Chairman. This is a very important discussion to be having, particularly as to how we care for our veterans in these highly rural areas. And you mentioned the transportation fund. In far too many of Alaska's communities, we're simply not connected by road. 80% of the communities in the state of Alaska are not accessible by road, so we've got to fly. So the expense is considerable. And then, of course, when you're in town, you have taxi, you have to rent a car, you have overnight accommodations. And so how we provide for those who are, we call them off the road system in Alaska, is a huge issue for us. One of the things that I thank you for your leadership, Secretary Shinseki, in Alaska, we have an agreement between the VA and the Native Health System where the veterans can go to the IHS facilities for that level of care. So it's within their region. It might not necessarily be in their village, but it's within their region, so they don't have to fly to the major cities for this level of care. And it was something that Senator Stevens and I had worked on. We think that it can be an opportunity, particularly in very rural areas, whether it's South Dakota or New Mexico. It was a great idea, and we want it to work, and the VA has really led on this, as they have led with telehealth. One of the things that I'm hearing anecdotally is from one of the larger and better health systems in the state, they're saying that they're not seeing the patient loads that they had expected. We're trying to drill down into this and find out, is it lack of publicity that the program is available? Is it lack of unfunded travel that's prohibiting them from accessing it? We're trying to understand how we can make it better, because we recognize we're never going to be able to get the providers out into these remote areas. So if we can work within existing systems, we've got more of an opportunity. So Secretary, if you can address that. I know Mr. Pretzel has been working on this, of course, for years diligently with us, but we want to try to make this work. We think it has great promise.
That's certainly our intent, and I was not aware that we haven't seen the response in the local clinics, and we'll certainly get on that. For this discussion about delivering health care to across the country, our commitment is a veteran living in a rural area or a remote area has the same entitlement to access to care, and that's what we're committed to. So there isn't a cookie-cutter approach to this. And we, everything from recruitment and retention bonuses to having an affiliation with a local medical school and bringing together VA's resources with what's already there, having this MOU with the Indian Health Service to provide services that veterans can get access to, and we reimburse for it, so that we're not trying to deliver something that's already there. And then telehealth, telemedicine, to give access wherever they are able to enter the VA system. So it's sort of all the above, and there is no cookie cutter that says since this worked in New Mexico, it'll work in Alaska. We tune these tools up as the situation needs, and certainly, as Dr. Petzel says, the challenge is recruiting folks to go to some of the rural areas, and the scholarship program here in small numbers is intended to get a promising youngster out of those communities, help with the education, and they'll be going home and working for the VA, and that's a work in progress. That's the next initiative we're trying to seed.
Well, and if we can work with you to identify how we might be more effective in reaching our veterans in these highly rural areas, we would like to do that with you.